can you improve your physical performance by eating less carbohydrates, by doing essentially the opposite of what every expert has been saying for decades? I'm going to discuss this topic with one of the true experts. I'm Andreas Jenfert from DietDoctor.com, and I'm here with Professor Steve Phinney, who's a low-carb researcher, medical doctor, and you're the author of a book called The Art and Science of Low Carbohydrate Performance. You know a lot about athletes and how to improve their performance by diet. Thank you for being here.
Thank you for having me, Andreas. This is coming back after a few years and looking forward to our discussion.
Yeah, so I know you know perhaps more than anybody about this, but just a short, introduction. Can you really do exercise without a lot of carbs, like bread and pasta and sports drinks and all that?
Yes, that's the simple answer.
Yeah, okay. Now we got that covered. Yeah, okay.
The somewhat longer answer is that with a well-formulated low-carbohydrate diet, which means not just taking away the carbs, but having enough of the right kinds of fat, enough of the minerals, and adequate time for the body to adapt. And that's the critical factor in achieving optimized low-carb performance. Not only can one do physical activity, in some circumstances, an athlete can outperform himself or herself on the best carbohydrate-containing regimen. And I say that because in the last couple of years, not only have low-carb athletes begun to win events, they're setting records in those events by using a optimized low-carb fueling strategy.
That sounds fantastic. Could you say who could benefit from this? Is it every athlete on the planet, or is it specific sort of sports, specific situations?
Well, we're just beginning to explore the potential for this because it is so contrary to all the dogma that it's been a little bit off-putting for some athletes to even give it a try. But the tip of the iceberg right now are ultramarathon athletes, any event that lasts longer than 3 or 4 hours, which puts the athlete at high risk of hitting the wall, or as we say, bonking. Those athletes can change their fuel flow to optimize fat oxidation and essentially free them from that risk of hitting the wall, free them from having to consume lots of calories during the event. And so the place right now where we see records being set and races being won is in the 50 to 100 mile running distances.
Quite long races.
Very long races.
Just one example of a guy who broke a record doing that. Can you give us that?
Well, there are a number of them. There's a ultra runner named Tim Olson who won the Western States endurance run, so-called Western States 100, which is a 100-mile run over the Sierra Mountains in California. And in 2012, he won it on a low-carb diet and took 21 minutes off the all-time record.
Sounds like a lot.
The race has been run since 1975, and 21 minutes is a big chunk off the record. And some people thought that was a fluke, or maybe he was doing something funny. The next year he came back and won it again. Again, by a similar, he beat his next competitor by about 20 minutes. And the person who finished number 3 in 2013 was a 42-year-old runner, Mike Morton, who took 6 minutes off the Masters record, again using low-carb fueling strategy. That got a lot of attention. So this is a hot area of interest among ultra-endurance athletes. That's one category. And the other category is people who, particularly aging athletes, who are still competitive, but they're struggling with signs of insulin resistance, which means impaired recovery, increasing body weight, difficulty achieving optimum body composition. So these are athletes for whom weight is important. For instance, Bodie Miller, who's the American downhill skier, won a bronze medal at the Sochi Olympics this last winter, and he's the oldest Olympic skier to medal. And he did it by using a low-carb diet to drop 30 pounds, which gave him better agility through the gates. Lindsey Vonn, the downhill skier, who's dominated the women's World Cup, or whatever, the downhill skiing competition among women, has used low carb, and she's in out in the media saying she's using it. It's not a secret. And her point, as I understand her interviews, because I've not worked with her directly, her point is that the low carb diet allows her to recover much more quickly from her training, which means she can increase her volume of training and be more fit than her competitors. In that case, it's not about weight; it's about optimized training in someone who might otherwise have a decreasing training capability because they're nearing the back, on the backside of the age curve for their sport.
So, if there's anybody watching who wants to get into this and try this out, what's important to think about? How do you get started on a low carb diet for athletic performance? How do you need some carbs? I mean,
excellent question. The first point I'd make is that going on a low carb diet doesn't mean just cutting out carbohydrates and casually trying to see how it works. This is a fairly complex change in diet, because when you remove carbs, first you have to go through an adaptation period that may be as long as a few months. In my research, I've only researched it formally for 6 weeks, and we know that if people start here on the low carb diet or on a high carb diet, and you take away carbs, their performance drops a lot in the first week. Then starts coming back up, and by 4 to 6 weeks, it's back to where it was before in terms of aerobic, that is endurance type performance. We really haven't explored how much of your anaerobic or sprint capability, but there's clear evidence that a few months out, people get back to the point of having some sprint capability. But to do this transition, A, it takes time, B, you have to be knowledgeable about electrolytes and minerals, because how your body handles electrolytes and minerals changes in that interval, in that time. You need to pay attention to getting enough sodium, and I repeat, getting enough salt, because salt is very important in a keto-adapted athlete, because the kidneys excrete salt more quickly, and if you restrict salt and carbs together, it will definitely impair performance.
Why? How?
Salt is required for blood flow. If you bite your tongue and you taste blood, it's salty. And if you don't have enough salt, the body constricts the blood volume. That's the exact opposite of what an athlete needs, because when you go from a standing start, or even if you're warmed up and then you start to exercise, you increase your blood flow volume. And that takes enough salt. The body has to have a little bit of extra salt to put in circulation. If you're short of sodium or salt, you can't do that. 5 to 10 minutes into high intensity exercise, you're going to be on your face, because you can't respond physiologically.
And on a low carb diet, you increase your need for some salt, right?
I won't say increase. You need, because the average American, the average person in the developed world eats plenty of sodium, unless they're consciously avoiding it because they think it will improve their health. So the point I want to make is don't restrict sodium and restrict carbs at the same time.
Okay, so how much sodium do you need?
As an athlete.
How much salt do you need as an athlete to make sure you don't suffer that sort of problem?
Again, as a doctor, just point out, if you don't have high blood pressure, if you don't have to take medications to remove salt from your body, so-called diuretics, and if you don't have congestive failure, heart failure. But that's, again, most athletes don't have those things.
Like healthy people without high blood pressure.
Without pre-existing medical concerns, the optimum sodium intake is around 5 grams per day. Now, my government says we should, in the U.S., we advise people, the whole population, to eat 2.3 or less grams per day. So I'm saying the optimum dose is 5 grams, which is twice that.
Yeah.
But
now we're talking about performance issues, right?
But again,
if you want maximum performance, you should be at around 5 grams, and not less.
And the question is there a risk of that? I mean, because many athletes will take drugs that they shouldn't take trying to optimize performance. But there is a paper published just recently in the New England Journal of Medicine just a few months ago that says that 5 grams for the average healthy population is not just okay, it's optimal. And if you go too low, even for a non-athlete, there are some risks with that. So a 5 gram number is a safe number, and nobody should shy away from that.
Sure. Anything else to think about for that aspiring athlete who wants to try this out? Get enough salt, and you said it's complicated. Mm-hmm. Could you elaborate on that?
Well, important point. Each of us is different. And so you just asked a minute ago, should they cut out all carbs or most carbs? How much carbs? And we're still exploring that scientifically. in formal studies. But in working with many athletes now in the last couple of years, they find that they can tolerate some carbs more than a person who's an overweight, insulin-resistant person trying to lose a lot of weight. For the athlete who's already probably pretty insulin sensitive, they can tolerate what we sometimes call strategic carbs. So they train low, but before a competition or performance, they may add in a modest amount of low glycemic carbs, say the night before. That will allow a little bit of extra, a little bit more glycogen in the muscles than they would have had if they stayed very low. And then, for instance, Tim Olson, during his first Western States run, posted on his blog that he consumed 100 calories of carbs per hour during his 14-hour run. So that's about 1,400 calories, which sounds like a lot of carbs, except in that time period, he burned probably 12,000 calories. So he was adding in about 10% of his energy expenditure as external carbs, bit by bit over, hour by hour over the race. And so that allowed him to probably function at a slightly higher percent of his peak aerobic power. And so we're still exploring the strategic carbs thing, but when you talk to athletes, each of them has to find out, it's clear that each of them has to find out what they tolerate. They need to try this in practice.